Definition of nephrostomy. A nephrostomy consists of the placement of a percutaneous catheter into the renal excretory duct to allow urine to be drained to the outside of the body. The indications for nephrostomy include urinary tract obstruction such as obstructive urethral or pyeluretral lithiasis, bladder tumours, prostate tumours, gynecological tumours, cervix, uterus and ovarian tumours, an extrinsic uteral obstruction. Nephrostomy can also be performed in case of a non-obstructive injury, such as surgical removal of urethra or urinary tract fistula. Major complications include sepsis. This rare complication associated with indwelling probes and catheters occurs when bacteria infecting the kidney spread to the bloodstream. It can be prevented with antibiotics. Hematuria. This complication is very common. Most bleedings are mild and require no treatment. Severe bleedings settle down on bed rest and are treated with cold saline solution washes. Pain. The patient may suffer some pain or discomfort at the nephrostomy tube entry point. Pain usually settles down in a couple of days with analgesics. Other rare complications are renal rupture with retroperitoneal urinary extravasation, perforation of small bowel loop or colon loop. One of the main measures to be applied to avoid these complications consists on changing the tube every 3 months approximately, depending on its permeability. Wash your hands thoroughly and put on new gloves to remove the old dressing. Wet new gauze pads with saline solution and gently remove the dressing. It is essential to proceed gently to avoid damaging the patient's skin and to keep the tube from being pulled out. Remove your dirty gloves and do hand hygiene immediately before preparing the sterile field. First of all, put a new pair of sterile gloves on. Place the green cloth and wet some gauze pads with chlorhexidine antiseptic solution. Wet some new gauze pads with saline solution. Take some gauze pads with the saline solution and clean the area around the nephrostomy tube. Take the gauze pads with the chlorhexidine antiseptic solution and wipe the skin in circles, moving away from the tube entry site. Please check if the tube is not longer than when it was put in. It is essential in order to verify that the catheter was not moved or come out of the kidney. Another important step to be taken when performing the care procedure is to verify that the nephrostomy catheter is permeable. Use a syringe with saline solution, gently force the solution into the tube and verify that the tube is not blocked. Use the adhesive strips to fix the tube to the skin. It is essential that the patient does not make any sudden movement that may tug on the catheter and make it come out. Place the adhesive strips in a bow knot. Take a whole gauze pad pack and cut a slit from the outside edge to the centre of the pads. Take another gauze pad pack and cut another slit from the outside of the edge to the centre. Fit the gauze pad around the nephrostomy tube to secure it. The three-way stopcock can be wrapped with a pad to make it more comfortable for the patient. Finally, place the dressing. Nephrostomy care procedure is performed every 48 hours during the hospitalisation. Once the patient is sent home, nephrostomy care is performed every 72 hours at the health centre. Nephrostomy tube home care instructions. Hygiene. Drink plenty of fluids unless contraindicated. Always wash your hands before any manipulation. Watch for any changes in your urine's appearance, hematuria, cloudy or purulent urine. Evaluate the skin conditions. Wash the tube entry area with water and neutral soap. Wipe away from the entry site and pat it gently. Do not use creams or lotions. Do not wear any tight clothing. You may shower with or without the dressing. Mobilization. Avoid sudden movements that may tug on the tube. It is essential that the catheter remain as long as it was when it was put in to prevent accidental extubation, despite the silk stay stature. Check to see if the urine tube is twisted or bent. The adhesive disc should be changed every 3 to 4 days. Change the draining bag daily. Life of relation. Follow a well-balanced diet, increasing the intake of food products rich in vitamin C, which acidify urine. Some products such as asparagus, onion, garlic, fish, seafood, etc. can cause the urine to have an abnormal or strange odour. During the day you may wish to wear a draining bag strapped to your leg to let you move around more easily. You may use a larger drainage bag at night to prevent urine from leaking out. Use the connecting tubes to attach a larger drainage bag to the nephrostomy device collection bag. Elimination. Avoid filling the collection bags too much. Despite collection bags are equipped with non-return valves, it is recommended to keep the drainage bag placed below the level of your kidneys. Contact your doctor or nurse immediately if there is blood in your urine, if the catheter comes out or is blocked, or if the area around the nephrostomy tube is irritated or painful. Signs to be alert for. Contact your doctor or nurse immediately if there is blood in your urine, if the catheter accidentally comes out, if you have a fever and severe costal pain, if the area around the tube becomes uncomfortable, looks red or swollen or feels warm, if your urine contains little crystals or stones, if your urine is abnormally foul smelling, and if any changes in the amount of urine occur, It is important to remember that we must lightly control the amount of liquids being drunk and eliminated. Large amounts of fluid can be lost through sweating in hot weather conditions or warm climates.